better watch.
Oh, my fearing whiskers. I'm late. I'm late for a very important date. No time to say hello, goodbye. I'm late.
It must be awfully important.
No. I'm overdue. I'm really in a stew. No time to say goodbye. Hello, I'm late.
This presentation will discuss absenteeism in the workplace, the impact of absenteeism in the workplace, and examining patient care, team dynamics, and constructive interventions. Absenteeism, absence from work or tardiness. Significance in the workplace, particularly in healthcare. Objectives. Explore the impact on patient care. Discuss the effect on team dynamics and staff well-being. Propose fair and constructive interventions. Impact on patient care. Quality of care. Consistent staff absence compromises timely and effective patient care. Delays in treatment, increased risk of medication errors, and reduced patient satisfaction. Patient safety. Research highlights the link between understaffing and adverse patient outcomes, such as healthcare-associated infections and errors. Derby et al., 2017, Hall et al., 2016. Example: a systematic review found that chronic absenteeism correlates with increased rates of delayed care and medical errors. Staffing disruptions. Unplanned absences lead to workflow disruptions, forcing remaining staff to manage higher patient loads. Case study: Stanford Nurse Study, 2021, observed higher error rates in units affected by absenteeism. Impact on team dynamics and staff well-being. 1. Morale. Regularly covering for absent colleagues fosters frustration and resentment, damaging team spirit. Increased workload and overtime. Understaffed shifts lead to additional responsibilities for present staff, often resulting in overtime. Burnout and fatigue. Continuous strain from absenteeism contributes to burnout, reducing job satisfaction and retention. BMJ, 2018. BMC Nursing, 2023. Workplace dynamics. Inequitable workload distribution undermines team cohesion and fosters conflicts. Studies show that equitable staffing practices are essential to maintaining morale and minimizing turnover. Supporting research. BMJ, 2018, increased nurse burnout is linked to dissatisfaction and higher turnover rates. BMC Nursing, 2023, equitable staffing and supportive environments mitigate stress and maintain team effectiveness. The cost of nurse burnout. Absenteeism contributes to high turnover rates and decreased performance. There is a direct correlation between burnout and reduced quality of care. This graph shows absenteeism rate correlates with burnout level. As absenteeism rate increases, burnout of colleagues rate increases directly. When an intervention decreases absenteeism rate, the burnout rate correspondingly decreases significantly. This chart shows how stress levels correlate with absenteeism with the rate dependent on the type of nursing being performed. Example: in emergency, if the absenteeism rate equals 12%, the stress level equals 85. Intervention strategies. Clarifying attendance policies. Establish clear expectations for attendance and tardiness. Implement accountability measures to ensure adherence to scheduling. Support resources. Provide access to counseling, flexible scheduling, and wellness programs to address underlying issues. Monitoring and feedback. Regularly review attendance patterns. Provide constructive feedback to employees with recurrent absenteeism. Promoting a positive workplace culture. Foster team collaboration and mutual respect. Encourage open communication about challenges and solutions. Call to action. Emphasize the collective responsibility to address absenteeism. Support initiatives to improve workplace morale and patient care. Questions and discussion. We invite your questions. We would like to facilitate a discussion on implementing these strategies in their respective workplaces. References. BMJ, 2018. Burnout and Healthcare-Associated Infections. BMC Nursing, 2023. Equitable Staffing Practices in Healthcare. Derby et al., 2017. Impact of Burnout on Medical Errors. Hall et al., 2016. Systematic Review on Staffing and Patient Outcomes. Stanford Nursing Study, 2021. The Cost of Nurse Burnout. BMJ, 2018, Burnout and Healthcare-Associated Infections. This study examines the relationship between healthcare worker burnout and the incidence of healthcare-associated infections, HAIs. The findings reveal that burnout, characterized by emotional exhaustion, depersonalization, and reduced professional efficacy, is a significant predictor of increased HAIs. Key insights include impact on patient safety. Burnout contributes to lapses in infection control practices, such as inadequate hand hygiene and improper use of personal protective equipment. Workplace stressors. High workloads, staffing shortages, and prolonged shifts exacerbate burnout, creating conditions conducive to errors. Organizational interventions. Strategies like promoting mental well-being, reducing workload through equitable staffing, and fostering a supportive work environment are recommended to mitigate burnout and improve patient safety. This research underscores the importance of addressing burnout to reduce HAIs and enhance overall healthcare quality. Hall et al., 2016, Systematic Review on Staffing and Patient Outcomes. This systematic review examines the relationship between healthcare staffing levels and patient outcomes across various settings. Key findings include staffing levels and patient care. Adequate staffing is directly linked to improved patient outcomes, including reduced mortality rates, fewer medication errors, and shorter hospital stays. Understaffing risks. Insufficient staffing is associated with delays in treatment, increased complications, and higher rates of adverse events, such as infections and falls. Nurse-to-patient ratios. Lower nurse-to-patient ratios are critical for ensuring better monitoring, timely interventions, and comprehensive care. Workload and burnout. Overburdened staff face higher levels of burnout, which negatively impacts both care quality and patient safety. Policy recommendations. The review advocates for policy changes to ensure optimal staffing ratios and investment in workforce sustainability to improve outcomes. The research highlights that ensuring adequate staffing is fundamental to enhancing patient safety, care quality, and healthcare efficiency. BMC Nursing, 2023, Equitable Staffing Practices in Healthcare. This study highlights the critical role of equitable staffing in maintaining effective healthcare operations and improving both staff well-being and patient outcomes. Key findings include Staff morale and retention. Fair workload distribution reduces feelings of resentment, frustration, and burnout, contributing to higher job satisfaction and lower turnover rates. Impact on patient care. Adequate staffing ensures timely, high-quality care, reducing the risk of errors, delays, and adverse events. Workplace dynamics. Equitable staffing fosters team cohesion, minimizes conflict, and promotes a supportive work environment. Recommendations. Implementing staffing policies that prioritize balance and fairness, alongside resources like flexible scheduling and wellness programs, can improve both employee and patient outcomes. The research emphasizes that equitable staffing is essential for sustaining a healthy, efficient, and safe healthcare environment. Derby et al., 2017, Impact of Burnout on Medical Errors. This study investigates how burnout among healthcare professionals correlates with the frequency and severity of medical errors. Key findings include burnout as a risk factor, emotional exhaustion, and depersonalization, core components of burnout, significantly increase the likelihood of errors in clinical practice. Error rates and patient safety. Healthcare workers experiencing high levels of burnout reported more frequent errors, including medication mistakes, diagnostic inaccuracies, and procedural lapses. Organizational implications. Institutions with high burnout rates among staff showed increased risk for adverse events and compromised patient care quality. Recommendations. Addressing burnout through interventions like workload management, mental health support, and fostering a positive work culture is crucial to reducing errors and improving safety. The study underscores that combating burnout is essential not only for employee well-being, but also for ensuring high standards of patient care and safety. Stanford Nursing Study, 2021. The cost of nurse burnout. This study explores the profound effects of nurse burnout on healthcare systems, patient care, and workforce sustainability. Key findings include burnout and patient safety. Burnout among nurses increases the likelihood of errors, including medication mistakes and lapses in infection control, directly impacting patient safety and satisfaction. Economic impact. High turnover rates caused by burnout result in significant recruitment and training costs for healthcare organizations. Workplace factors. Contributing factors include excessive workloads, inadequate staffing, and insufficient support systems, which exacerbate stress and emotional exhaustion. Interventions and outcomes. Strategies such as wellness programs, mental health resources, flexible scheduling, and team-based support reduce burnout and improve retention. The study emphasizes the need for systemic changes to address burnout, as reducing its prevalence not only benefits nurse well-being but also enhances patient outcomes and lowers operational costs. Suggestions.
1.
Reward staff for their attendance and punctuality. Suggestions.
2.
Request doctor's note for recurring absenteeism. At present, one requires a doctor's note if absent for 3 consecutive days, even though that employee may otherwise be present for the remainder of the year. However, if an employee is absent for 150 days per year and yet no days consecutive, there is no requirement for a doctor's note. Suggestions.
3.
If an employee has been late for work, they should complete their full shift. At present, an employee can be quite late for work and still leave on time. Suggestions.
4.
A meeting should take place to discuss absenteeism, absence and/or tardiness between management and the employees. An example would be if the employee had greater than 10 days absenteeism for that year period, a discussion about the frequency and pattern of absenteeism should take place. A pattern of absence on a day before shift begins or day after shift ends suggests several possibilities. A. Burnout. B. Alcoholism or drug addiction. C. Need for extended days off. D. over-reliance on fellow staff to accommodate to need for holiday time. Let's have a discussion.
And a what?
Oh, my fearing whiskers. I'm late. I'm late. For a very important date. No time to say hello, goodbye. I'm late.
It must be awfully important.
No. I'm overdue. I'm really in a stew. No time to say goodbye. Hello, I'm late.